And thank you for joining us. With us is Dr. Mark Lewis, practices family medicine with a focus on natural medicine. Dr. Lewis, thanks for joining us.
My pleasure.
Well, tell us about yourself.
Well, I've been working with Meadville Medical now for 12 years. My practice has been a mixture of family practice and some integrative, natural, and alternative. I'm also an osteopath and have a big interest in osteopathic manual medicine. So I do a lot of musculoskeletal work, people with back pain, neck pain, shoulder, knee, that sort of thing.
Which is quite common.
Yes, very common.
So before we get into the specifics of that, what age did you know that this was the path you wanted to take?
I guess I was like 29, 30. I was kind of a late bloomer. I had walked into a clinic in Columbus, Ohio that had natural, integrative, alternative, also had a chiropractor there. And I don't remember why I saw him, but I went and really caught my eye about the musculoskeletal, and it just made common sense to me. So I started some discussions, got some other names. Actually, at the time, I was kind of trying to figure out what I was going to be doing with my life. I was going to be graduating in a couple of years with a biology degree. So I started looking to understand it better, and that led me into osteopathic medicine, and went from there, I guess.
I have to ask, what were you doing up till late 20s?
Well, I had gotten married, and I was working at Ohio State University. I hope that doesn't offend anybody. But
it's okay.
Yeah. But I was working in a cancer center, and so I did that for about 7 years, and at the same time I was doing my undergrad. And then thought maybe I could become an osteopath. So that involved getting pre-med curriculum done, doing an MCAT, which is the medical exam to get into any osteopathic or medical school. And then the rest was, I wound up going to Ohio University College of Osteopathic Medicine in Athens, Ohio. So, and getting to Northwest Pennsylvania happened after I graduated. I went to do my internship up in Erie at Mill Creek, and I did my residency up there I was up there for 3 years, and then I left and we moved to Toledo, Ohio. And Toledo, Ohio was the option because they put me in charge of an osteopathic manual medicine section in the hospital where I had to teach interns, residents, and students. So,
what was that experience like?
That was a very gratifying experience, satisfying, because I do like to teach. And so when you have a student that's interested in what you're doing, it's there's a lot of satisfaction in that. So that was for 8 years, and then they closed down the program, and so I came back to Northwest Pennsylvania and been here for about 20 years now.
Wow.
Yeah.
And we'll talk a little later, but there'll be another move that we're going to be discussing with your practice. But what was that like for you, setting up your practice and starting to see patients and those families and getting to know them?
I've always been very attracted to family practice because I like getting to know the families, the mothers, fathers, kids, and grandparents, and so forth. So I like being able to know the whole family. And the other thing about family practice is, for me, it's more of a holistic approach because we really have to know almost everything about all the different body systems in some fashion. So, and my mind is always kind of working on what ifs and, you know, can this work, can that work, and what else do we need to look at? So,
do you enjoy the sort of that quaintness and getting to know families? And you say you're working with kids, adults, maybe grandparents, so you get to see almost the whole family tree.
Yeah, and you get to develop a relationship, which really is nice to develop that. And then over time, it takes several years. You develop trust and understanding. I know what that, you know, a patient walks in a room and I can immediately have a whole picture of what's going on in their life.
Wow.
And how better to help them.
So what sort of things from the family medicine side do you get when people are coming in to see you? Kind of give us just a range of things that people are coming to see you.
Oh, that could be for just blood pressure, it could be for blood sugar, it can be headaches, it can be, you know, this morning I had a patient with Parkinson's, and I certainly see a lot of back pain, musculoskeletal stuff too. So, yeah.
So every day is a little different for you.
Yes, that is the other advantage for me, is that there's always variety. It's never the same thing. Yeah.
What do you want your patients to walk away knowing about you and your practice?
I guess I would like them to know that I am looking for ways to help them feel a better level of wellness, you know, and I'm looking for ways that their body can do it for them, and they can help their body to get better. Yeah, I'm looking for. I'm not looking so much for disease management. I'm looking more for wellness.
Well, and that was going to lead me into the next part of the conversation, that natural, holistic approach.
Yeah.
I think people hear that, but may not understand what that means. What would you say to those folks who have heard of it, not sure of it, have questions about it?
I'm trying to distill it down into a few words, but it's hard.
We have some time, so.
Okay. I would say that it would, it involves using, you know, our own inherent ability to heal. And we are in a time when we're learning more and more about how the body naturally takes care of itself and how we can support that. So that's what gets me excited, is that I can help someone heal rather than just continue to maintain a lower level of functioning or wellness. And I guess I try to use as much lifestyle changes as we can. Also supplements, diets are really important. To help people change the way they're feeling. So, yeah.
And that's sometimes easier said than done, right? We live in this fast food society where people want things now. They want to feel good now.
Right.
But really working hard towards something and letting the body make those adjustments and giving it time can be a challenge.
Yes.
Because people, you know, they see the commercials, you know, take a pill and you're fixed.
Yep.
But the reality is, it does take work, doesn't it?
Yes, it does. It's a commitment. It takes some self-discipline. It's and some people are just not in that frame of mind. Sometimes their life is just too hectic or chaotic to be able to make changes. So I have to be able to work around that too. Yeah.
Is that a lot of discussion time with your patients, or do you feel like they want to make that commitment and they want to have those conversations with you?
There are some that do, and I will spend time with those patients, the ones that really want to make that commitment and really are interested. So, yeah.
Let's talk a little bit about OMT.
Okay.
What is OMT? And let's get into the specifics.
Yeah, what the term means is osteopathic manipulative treatment. And it's basically a hands-on approach to adjusting the tissues of the body, joints, muscles, connective tissue, and it can involve any part of the body. It can involve the head, it can involve all the way to the feet. And osteopathic originated in Missouri in the 1800s. So, and it's in this area we have an osteopathic school up in Erie. We have another one in Philadelphia, and they're popping up. I think there's another one getting ready to get started in Pittsburgh. So we have quite a few osteopaths in this area.
If you don't know, what would be the difference between that and like chiropractic or chiropractor?
Yeah. Well, chiropractic in general is their focus tends to be more on the spine. They also have a big focus on the joints of the spine and the nerves. And their techniques, they have a variety of techniques, but their focus again is mostly on getting the joints to line up and get into alignment. Osteopathic manipulation is broader. We pay attention to the muscles, the fascia, the connective tissue, and work with that as well as, say the joints, the spine, the nerves. So we try to, it's a little broader. An osteopathic treatment takes longer than a chiropractic treatment because there's more stuff to check and treat. I think I was just looking at my list of different treatments, and I probably do about 12 to 14 different techniques by name.
Wow.
Yeah. Whereas most chiropractors do one or two. And that's my nature to keep learning and keep growing and keep, finding better ways to do things. So I've done a lot of extra training in that. I actually have a board certification also it's called neuromuscular medicine. That's the osteopathic branch of specialty in osteopathic manual medicine.
So what sort of conditions are people coming to you with?
With osteopathic, it's back pain, of course, is a big one, neck pain, headaches, leg pain, sports injuries, that sort of thing. It could be any type of a musculoskeletal injury. I have people that come for me for their jaw,
Wow.
just to treat the jaw. And I treat newborns. It's one of my favorite things to do is when babies are born, sometimes their heads can get really misshapen, and that can cause various problems. So there's a whole set of techniques for that, which I do.
And when you look at sort of that snapshot of the typical person in Northwest Pennsylvania, like to play hard, work hard.
Mm-hmm.
So sometimes the body
gets worn down,
worn out a little bit, right?
Yeah.
So and obviously with those different conditions, there's different treatments, as you were
Correct.
saying. There's a lot of options.
Right. Yeah. I will look at, certainly use physical therapy quite a bit, if necessary. And then I have a whole nother set of treatments that I do that involve injections. That's called regenerative medicine. And, but yeah, with my specialty, I can look at the whole picture, and I can order a test if I need an MRI, or if I need an ultrasound, or if I need an X-ray, I can get that. And I can also help with, if I need to use medications to control pain for a little while, I can do that.
So there's various therapies that can be applied to different situations.
Right.
Just on the injection side, is that something where an injection that will last days, weeks, months, it just varies?
It varies. If we're talking about regenerative medicine, which is prolotherapy, platelet-rich plasma, or PRP, or stem cells, that can, when it's done over when you correct the tissue and heal the tissue, it can last for years. But it may take several months to get to that point.
And that doesn't mean that you're just getting the shot and going right back doing what you're doing. You should still be making some lifestyle changes at that point, correct?
Yeah, I talk to people a lot about their diets and exercise. So
obviously there's the medication side to deal with certain things, but then you also have on the natural side, right? Vitamins, supplements, things like that.
Right.
How does that play a role in the therapy side of things?
Well, one of my favorites is vitamin D, which is in this part of the country and on our location, vitamin D levels are generally low or low normal. And vitamin D can act as an anti-inflammatory. So when it gets really low, you can get joint pain and muscle pain and bone pain. So I will usually test for that with a blood test. And then, based on their level, I usually recommend vitamin D daily for almost all my patients. But that can help with their pain, for one thing. And there's a lot of other, vitamin D helps with mood. It also helps with asthma. It helps with blood pressure. So
when somebody's getting a blood test for that, are you testing for other deficiencies, or is it specific to vitamin D or?
No, I check for a lot of things. Depends on the person, but I will usually also check a B12. It depends on what their complaint is. So there are, for instance, muscle pain could be a magnesium deficiency, so that might get tested. So.
And you hear a lot iron deficiencies and things like
yep.
that.
Mm-hmm. Yep.
So again, that's one of those things where they'll schedule an appointment with you, and you start to have these conversations, and it's maybe sometimes it's just when you know somebody, you're talking with them and you're kind of figuring out, oh, you know what?
Yeah. In my mind or on paper, I'm noting things as they respond to things, and I know what I'm listening for certain complaints to tell me what direction I should go. So
again, it has to be challenging in a good way, where every day is a little different, and trying to put those puzzle pieces together.
Yes, that's a good way to put it. The puzzle pieces, because that is the way I look at it. It's a puzzle. If I have a patient come in with fibromyalgia, that's a real big puzzle. And if they're willing to work at it, it can take a while, but you can figure out the puzzle. We can help them feel better.
We understand that there's going to be an upcoming move.
Yes.
Let's talk a little bit about that.
Okay. Yeah, I will be moving to Linesville, Pennsylvania. My first day there is May 6th, Monday, May 6th. And kind of excited about it. It's going to change the character of the practice. I'm going to be focusing more on holistic, natural, and musculoskeletal. So I'll have a better opportunity to treat that sort of patient in my, and it's also going to change over to a cash practice, which is going to be different, and we're hoping that that's going to support itself.
So like the old school way you used to go to see your doctor.
Yes. Yeah, it's the old school. It's 40, 50 years ago, so we'll see. But yeah, I am looking forward to the fact that it's going to be, I'll be able to focus more on the things that I'm passionate about.
So when the office opens up, the kind of patients that you want to see include who?
Well, I definitely, with the focus on the musculoskeletal, any kind of musculoskeletal complaints are of interest for me. And another would be just people that are looking for natural ways to get well. And I think the other would be, I would love to see newborns, just because of the work on the head and stuff. So
I don't think people realize the amount of trauma when it comes to delivering a baby.
yes, we don't all realize how much the baby's head has to change, and actually the bones in the head have to overlap and move in order to get through the birth canal.
What sort of hobbies do you have?
Hobbies. Hiking is one of my hobbies. Aquariums. I only have one, but I do enjoy having, fish. And got 7 grandkids to play with whenever they're over, which is almost every other day.
What do they like to do?
I have one that he likes to hike. I got one that's likes theater, and so we get to go to a lot of shows. I have a couple of little ones that just like to run around and blow bubbles. So
It's the little things in life, right?
yes, exactly.
But with what you do, just the natural and holistic approach, just being out in nature and enjoying that fits.
Yeah. Yes, it does.
So.
Yeah.
We want to thank you for your time. And again, real quick, your new office location, you'll be open when?
Starting Monday, May 6th. The address is 210 Mercer Street, Linesville. I don't know the zip code.
Okay. And they can call the office?
Yeah, they can call the office and schedule anytime.
Great.
Okay.
Dr. Mark Lewis joining us. Thank you for your time.
Thank you.
And thank you for joining us once again.